Imagine waking up in the Ice Age with a throbbing, white-hot nerve pain shooting straight up into your skull. You cannot call an emergency dental clinic. You cannot take a sterile painkiller. You cannot sit back in a cushioned chair while a doctor injects local anesthesia into your gum. Yet, when archaeologists examine skulls from deep antiquity, they find something that defies belief. Over 14,000 years ago, long before the invention of metal, electricity, or modern medicine, someone held down a groaning human being, grabbed a razor-sharp chip of flint, and began manually scraping out infected, rotting pulp from deep inside a living tooth. How on earth did ancient humans survive cavities without losing their minds from the agony? To understand how our ancestors dealt with tooth decay, we first have to understand a surprising biological paradox. For most of human history, hunter-gatherers actually had remarkably healthy teeth. When you dig up the skulls of early Homo sapiens who lived off wild game, fibrous tubers, raw greens, and seasonal berries, their smiles are often straight and almost entirely free of decay. They did not brush with mint toothpaste or floss every night, but their low-sugar, high-fiber diet acted as a natural scouring pad. Chewing on tough meat and gritty roots naturally scraped away plaque before it could calcify. More importantly, their oral microbiomes lacked the aggressive acid-producing bacteria that define modern decay. Then, around 12,000 years ago, everything changed. Humans invented agriculture. We stopped roaming the wilderness and settled down to farm wheat, barley, rice, and maize. While farming allowed civilizations to boom and populations to skyrocket, it was an absolute disaster for human dental health. Grains and starchy porridges broke down into sticky, fermentable carbohydrates in the mouth. Suddenly, microscopic colonies of Streptococcus mutans began feasting on these residual sugars, producing relentless waves of lactic acid that melted through tooth enamel. Within just a few generations, dental abscesses, rotten roots, and agonizing cavities exploded across the prehistoric world. Humanity was suddenly trapped in an epidemic of toothache, and something drastic had to be done. This crisis forced our ancestors to invent prehistoric dentistry. In northern Italy, researchers made a staggering discovery when examining the fossilized remains of a young Paleolithic hunter who lived roughly 14,000 years ago. One of his lower molars had severe decay, but it was not left to rot. Under high-powered electron microscopes, scientists discovered microscopic striations on the enamel. Someone had used an ultra-fine, razor-edged flint microlith to meticulously carve, scrape, and gouge out the infected organic tissue. It is the oldest known evidence of intentional dental surgery in the archaeological record. As millennia passed, the tools became even more sophisticated. In the Neolithic settlement of Mehrgarh, located in modern-day Pakistan, archaeologists unearthed 9,000-year-old skeletons with perfectly circular, microscopic holes drilled into their molars. These early practitioners did not just chip away with stone knives. They used tiny, high-speed bow drills tipped with flint points. By wrapping a leather cord around a wooden spindle and sawing a bow back and forth, they could spin a microscopic stone drill bit thousands of times a minute, boring neat, smooth holes through tough enamel in under 60 seconds. But drilling away the infection was only half the battle. Once you hollow out a decayed tooth, the raw, exposed nerve will scream in agony unless you seal it shut. In Slovenia, researchers discovered a 6,500-year-old human jawbone featuring a deep vertical crack in the canine. Pressed carefully into the fracture was a dark, hardened substance. Chemical analysis revealed it was ancient beeswax. Long before synthetic resins or silver amalgams, prehistoric healers warmed raw beeswax and molded it directly into the excavated cavity. The wax not only acted as a physical barrier against food, debris, and air, but it also contained natural antibacterial compounds like propolis, which prevented further infection and soothed the exposed nerve. Still, you might wonder, how could anyone endure the sheer, bone-shivering shock of a stone drill cutting into living dentin? The answer lies in the deep botanical knowledge of ancient healers. Hunter-gatherers and early farmers possessed an encyclopedic mastery of the surrounding flora. When dental pain became intolerable, they turned to nature's pharmacy. To dull the pain, they chewed on raw willow bark, which contains salicin, the natural precursor to modern aspirin. They packed throbbing gums with wild clove and crushed thyme, using the potent numbing agent eugenol to desensitize raw nerves and fight foul-smelling bacterial blooms. When the pain required deeper relief, shamans and medicine workers turned to mind-altering plants. Infusions of wild henbane, nightshade, and opium poppy sap were administered to induce heavy drowsiness and disassociate the patient from their physical agony. In some northern cultures, mild psychoactive mushrooms were chewed before surgery, altering the perception of time and pain while the stone drill did its work. The story of ancient cavities is not just a tale of crude stone tools and sticky beeswax. It is a testament to human resilience, ingenuity, and the relentless drive to heal one another in the harshest conditions imaginable. Long before the birth of science as we know it, our ancestors refused to simply suffer in silence. They observed, experimented, and developed complex medical techniques out of sheer necessity. Looking back at their methods, it leaves us with an unforgettable question to ponder. If you were suddenly transported back 10,000 years with a screaming toothache, would you trust an ancient healer with a bow drill and a piece of beeswax?